A lot of efforts at various things, but it's not been well coordinated.
A wake-up call for those on the front lines of the opioid crisis in our community. While parts of the country are now seeing fewer people dying, the exact opposite is happening here in Ohio. Tonight, only on News 5, we are asking why. The difference in overdose deaths nationwide is startling. 14 states now reporting a decrease, while the Buckeye State saw a spike of nearly 40%. News 5's Mike Brookbank in our newsroom right now. And Mike, there are quite a few factors that are tied to all of this.
Yeah, Danita, prevention efforts to a shift in preferred drugs. They're just a few. But at the end of the day, there are some things that we can learn from states seeing improvement.
Killer cravings.
Everybody I talk to has a story.
They're the stories of loved ones lost.
They're mounting up in the morgue.
Risking it all for that next high.
We have not hit the peak yet.
In Ohio, overdose deaths are soaring.
Typically, it's younger people, 21 to 25 years old, typically Caucasian.
At a time when more than a dozen states report a decline.
So while we are seeing overdose deaths increasing, we're also seeing the numbers of people in treatment increasing.
Jonathan Lee's mentor-based Signature Health providing that much-needed help.
We have several hundred people in treatment.
As for why so many more people are dying from overdoses here in Ohio than elsewhere,
sooner or later this will crescendo and it will move on to other substances, unfortunately.
Lee tells me that's exactly what addicts in other states may be doing.
People are starting to see more and more positive urine screens for crystal meth.
Lee says the drug, which is harder to die from, is now making a comeback outside Ohio. As for tackling overdoses from opioids, Lee wants to see more focus put on education and prevention.
And there have been a lot of efforts at various things, but it's not been well coordinated.
While changing prescribing habits among doctors has been a big focus of the fight, in Ohio, Lee says that's a small drop in the bucket in the push to save lives.
Much of what's going on is synthetic in nature. It's not that a manufacturer has made it or that a doctor has prescribed it. It's out on the streets.
Lee wants to see more money put into prevention and more coordination between states.
We absolutely need to network with our colleagues, mostly towards the west portion of the United States, that aren't seeing the same kind of increases that we are here in the Midwest.
Now, to give you some perspective close to home, in Cuyahoga County, more than 800 people died from an overdose last year, up from 666. The number of them due to heroin dropped, but synthetic carfentanil and fentanyl deaths skyrocketed. In the newsroom, Mike Brookbank, News 5.